So hi Catriona, thank you so much for coming in. You are a Pediatric Occupational Therapist.
Yes, that's right.
So it's a bit of a mouthful.
Yes.
So Catriona is my sister, and over the years I have absolutely used Catriona in every respect in terms of mummy cooks. And it was, when I had that first idea of having a class and bringing mums into the class, it wasn't just about the food, it was about how do you teach a child to eat? Mm-hmm. How do you get a child to not be a fussy eater? And that was my aim. And with the help of Catriona and a lot of research, I think that's how mummy cooks began and how it is there. A lot of discussions, exactly. So I'm trying to think now about, I've been thinking about what are the things that I've really learned from Catriona in terms of introducing utensils, because that's one of the big things that I get asked on at my classes, or a lot what we write about. So rather than go out and buy a lot of things, it's really important to have a spoon for feeding
and for motor development. Yes, is really important, because they're learning how to take something off an object. Yeah.
Okay, so I think that's a really key point, because again, there's this debate about baby-led feeding, which is just the finger food. Fantastic, the child is picking the food up and eating it, but I just, we're going to use a fork and knife at some stage, so I think that if you give something to a child at 6 months, they're going to go on and use that further on.
Yeah, and also, there's so much muscles in your mouth.
Okay.
And you need to start developing and working on them all.
Okay.
For speech. Yeah. Because we use so much for speech.
Brilliant.
And for blowing,
and
for sucking, for everything.
We don't think of that, actually.
No. And that's what you're beginning with.
Yeah.
I'm sorry, not beginning with, but that's what you're beginning to develop.
Okay.
Control.
Okay.
And that's what a spoon does.
It's
the child starts learning how to deal with another object in their mouth, how to use the tongue, so that they're developing the muscles of the tongue, which are all important for speech.
Okay, so let's say I have a 6-month-old, and again, you're letting baby lead the way, so you're giving a mixture of finger and puree, but the baby's having none of it. They want to be fed, so their hands up, and they're so I'll try to give a spoon, and I'll put the spoon, and I'll give them every opportunity to give the spoon, but I always say to parents, they're really not going to succeed with it until a little later. Yeah. But what type of spoon do I give?
Well, it's all about how narrow it is.
Okay.
Yeah, so you don't want something that's too big in the mouth. You want something more that's it's narrow.
Yeah.
Yeah. And again.
Okay, so why narrow? Because
their mouths are much smaller.
Yeah, they are.
And you don't want something so big that they're choking before you even get it in.
And maybe it's touching off the sides of their lips, and it's a really strange.
And also, you're not loading it huge, so you're only using really the tip of it.
I think that's a really good point, because I think we're probably in a rush to get this dinner over with, and we're overfilling spoons, and that's causing gagging. So I always say to mums, before 6 months, it's like a third, so the tip of it, and then maybe half then from 6 months, if the child's able to manage it.
Exactly. And they're only learning.
Yeah.
It's kind of for fun as well, but also a developmental stage that you need to work forward with. But they'll want to do everything with the spoon. Okay. And that's why just keep it at the top.
Okay.
And they'll have more chance of actually getting their lip down on it and getting to remove it themselves.
Okay, brilliant. So nice and narrow. Another one is not too deep.
That they have to really work on getting it out.
Okay. Yeah. Okay. Perfect. Okay, so that's the spoon. Beaker. So again, you're going to be giving a beaker from 6 months. They don't need the water, and that's the confusion here, is they don't need the water, it's all in the milk, the liquid's in the milk. However, starting at 6 months really will pay dividends, because the baby will go on to have a beaker.
Accepted.
Another one is lots of mums maybe can still breastfeeding, and they're struggling to get the baby onto the bottle, and sometimes they skip the bottle and they go straight onto the beaker. So training them at 6 months is vital for that mum.
Yeah, no, totally.
Yeah.
And again, it's really good that you're changing again. So and actually at that time, At 6 months, it's really about exploration. Like they'll turn it upside down, they'll play with it, they'll suck the bottom of it. You know, it's not, as you say, about drinking from it.
No.
But they will eventually learn that, because they'll start figuring out, oh, actually, wait now, accidentally something came out.
Yeah.
And what you want to do is develop. So if you think of it, when they're breastfeeding or when they're on a bottle, they're sucking. So the idea of introducing a cup or a beaker is that you want to develop sipping.
Sipping, okay.
So they're again,
which is very different, because when you suck, you're like, and when you're sipping, you're just
very different. You're getting your lip closure. Again, for controlling your feeding and for controlling saliva. Brilliant. And eventually, obviously, your speech.
Okay, so when I'm looking for a beaker, then I'm looking for something that I am not sucking, but I am sipping.
Yes.
So either like a small cup type idea. This is an egg cup, but something that's very small. But
you're only offering that small amount of water, a very small amount, that they get one sip.
Yeah. Brilliant. So again, there's lots on the market. We've had a look at a few here, and we kind of like this one here, where this is you bite that one. Not so mad this one because you're sipping it.
Yeah, and it's really hard. The valve is really hard.
Really hard.
Very hard to do.
And then we had to look at this one, which is a very different type of thing, where you're it's 360, as you said.
Yeah.
So you can, the child doesn't have to pull it around.
No, it's all the way around.
And then you're pressing it, their child is lipping down. Now the one thing about this is it is quite heavy, even in my own hands, so I think it's for maybe an older child. But a lovely one to maybe think about later.
Move on to, especially when they start figuring out if they can spill all the water out of this one.
Yeah. So I think the best thing to take away from this is the top tip for a beaker is, number one, introduce it at 6 months. So you've always had a beaker there. Number two is that you just keep trying different beakers, and again, as Catriona said, it's maybe the sip rather than the suck, but you will find you'll have hundreds of beakers with lots of different missing parts. So do just keep trying different beakers. With the spoons, I think it's exactly the same thing, but as Catriona said, you're looking for something that's narrow and has not too deep, and that the child can hold. So we didn't find something perfect on the market, but there's lots of different options out there, and that's what you need to be looking for. In terms, just one more question, I guess, in terms of occupational therapy and in terms of that whole mouth, is there anything else that you think that they need to really be looking at in the first year?
It's all about, I suppose that's where your finger food comes in, because again, you're moving them, you're not always giving them puree.
No.
You're moving them through their to be lumpy in different stages, exactly. So it's all about developing the movement within the mouth. So if you think about it, when you eat yourself, your tongue goes everywhere. Yeah. You know, because you're pushing the food to both sides, what we call laterality. Yeah. And then you're also wanting to come back to your molars at the back to eventually chew. Yeah. So that's what you're doing, and that's what you have to think that you're getting your child to do, that they're not constantly sucking. Yeah. Because when you suck, it's not going anywhere near the mouth. So you're not developing the tongue.
It's just fascinating. I think that every little stage of development of your child leads on to the next.
Yes.
Like I would often say, like, you know, that finger food develops hand-eye coordination, but then it also develops crawling skills or writing skills. Yeah. Fascinating.
It is fascinating.
It is fascinating.
And you know, the interesting thing is children will develop it themselves. Yes. Watch them. You know, the majority of children, thankfully, we don't have to intervene. Yeah. They naturally progress. Yeah. But just give them the opportunity.
And don't be looking at other children.
No, don't compare. Don't compare. Every child is so different.
Oh, I had two very different children, and I think probably the first was just, you know, probably I didn't have the second one to compare, you know, so the second one was kind of like, she didn't do that, but actually, you know, they're so different, and they're fine today. They can walk, and they can talk, so it is definitely about relaxing a bit, and they will,
and follow and look at, trust your child, you know, and if you do obviously see difficulty or concerned, it is about going to your public health nurse.
Brilliant.